Welcome. Today we're diving deep into a common heart rhythm disorder known as atrial flutter. We'll explore what it is, what causes it, how it affects your heart, and the options available for treatment and management. Whether you're a healthcare professional, a patient, or simply curious about heart health, this video will provide valuable insights. So, what causes atrial flutter? The primary culprit is often structural heart disease. This can include conditions like high blood pressure leading to left ventricular hypertrophy, coronary artery disease, heart valve problems, or even previous heart surgery. Conditions that dilate the atria, such as heart failure or chronic lung disease, also significantly increase the risk. In some cases, atrial flutter can be triggered by hyperthyroidism, alcohol abuse, or certain medications. Now, let's understand the pathophysiology. In a healthy heart, electrical signals originate in the sinoatrial or SA node and travel through the atria in an organized way, causing them to contract efficiently. In atrial flutter, however, a reentrant circuit, typically located in the right atrium, develops. This means the electrical signal gets stuck in a loop, rapidly firing and causing the atria to contract at an incredibly fast rate, often between 250 and 350 beats per minute. While the atrioventricular, or AV node, acts as a gatekeeper and doesn't allow all these rapid impulses to reach the ventricles, some still get through, leading to a faster and often irregular heartbeat. This inefficient atrial contraction can compromise cardiac output and increase the risk of blood clot formation. Atrial flutter isn't quite as common as atrial fibrillation, but it's still a significant health concern. The precise prevalence is difficult to determine, but it's estimated to affect hundreds of thousands of people worldwide. It's more prevalent in older adults, individuals with underlying heart conditions, and those with risk factors like high blood pressure and obesity. Knowing this helps us understand who might be more susceptible and allows for proactive monitoring. What are the signs and symptoms of atrial flutter? Many people experience palpitations, a sensation of a rapid or fluttering heartbeat. Other common symptoms include shortness of breath, fatigue, lightheadedness, and chest pain. Some individuals, however, may not experience any noticeable symptoms, especially if their heart rate is relatively well controlled. It's important to be aware of these potential signs and seek medical attention if you suspect you might have atrial flutter. Diagnosing atrial flutter typically involves an electrocardiogram or ECG. This simple, non-invasive test records the electrical activity of your heart and can clearly show the characteristic sawtooth pattern of atrial activity that's a hallmark of atrial flutter. Your doctor might also order other tests, such as a Holter monitor for longer-term monitoring, or an echocardiogram to assess the structure and function of your heart. While atrial flutter isn't formally classified into distinct subtypes the way other arrhythmias might be, it's often categorized based on the typical location of the re-entrant circuit, with typical atrial flutter referring to that right atrial re-entry that we discussed. Atypical flutters have different re-entry circuits. The treatment of atrial flutter focuses on controlling the heart rate, restoring a normal rhythm, and preventing blood clots. Medications like beta blockers and calcium channel blockers can help slow down the heart rate. Antiarrhythmic drugs can be used to convert the heart back to a normal rhythm. However, the most effective long-term treatment is often catheter ablation. This minimally invasive procedure involves using radiofrequency energy to destroy the re-entrant circuit in the atrium, effectively eliminating the source of the arrhythmia. Anticoagulants, like warfarin or newer oral anticoagulants, are often prescribed to reduce the risk of stroke, especially if a patient is at risk for blood clots. Preventing atrial flutter primarily involves managing the underlying risk factors. This includes controlling high blood pressure, maintaining a healthy weight, managing cholesterol levels, and avoiding excessive alcohol consumption. If you have an existing heart condition, working closely with your doctor to manage it effectively can also help reduce your risk. The prognosis for individuals with atrial flutter varies depending on the severity of their condition, the presence of underlying heart disease, and the effectiveness of treatment. With proper management, many people can live normal, active lives. However, uncontrolled atrial flutter can increase the risk of stroke, heart failure, and other serious complications. Ongoing research is focused on improving ablation techniques, developing new antiarrhythmic drugs, and identifying genetic factors that may predispose individuals to atrial flutter. These advances hold promise for even better prevention and treatment in the future.